As people age, their joints naturally experience a gradual decline in resilience due to years of wear and biological changes in cartilage, connective tissue, and bone structure. When obesity is added to this equation, the deterioration accelerates significantly, particularly in the weight-bearing joints like the knees, hips, and lower back. The link between obesity and osteoarthritis in aging is not simply a matter of added mechanical pressure, though that alone is damaging, but also involves metabolic and inflammatory factors that degrade joint health from the inside out. This dual burden makes osteoarthritis more severe, more painful, and more likely to lead to long-term physical disability and loss of independence in older adults. Each extra pound of body weight increases the compressive force on the knee joint by roughly 4 pounds during walking. For someone carrying an extra 25 to 50 pounds, this equates to hundreds of additional pounds of pressure on the knees with every step. Over time, this leads to accelerated breakdown of cartilage, the smooth tissue that cushions the ends of bones in a joint. When this cartilage erodes, bones begin to grind against each other, causing pain, swelling, stiffness, and limited range of motion. Osteoarthritis in the knees is particularly common among obese older adults, and its progression tends to be more rapid and difficult to manage compared to those with a healthier weight. But the story doesn't end with mechanical strain. Adipose tissue is not inert. It actively secretes inflammatory molecules known as adipokines, including tumor necrosis factor alpha, TNF-A, and interleukin-6 (IL-6). These substances circulate through the bloodstream and contribute to systemic low-grade inflammation, which not only damages joint cartilage, but also affects the synovial fluid, the lubricating fluid in joints, making it less effective at protecting against friction. This internal inflammation amplifies joint degeneration even in non-load-bearing joints like the hands, which supports the idea that osteoarthritis and obesity is as much a disease of inflammation as of wear and tear. In older adults, the consequences of this joint damage are far-reaching. Pain becomes a daily presence that discourages physical activity, which is essential for maintaining mobility, cardiovascular health, and muscle strength. As pain and stiffness increase, older individuals often avoid movement, leading to muscle loss, sarcopenia, weight gain, and further joint instability. The fear of pain or injury may cause people to avoid walking or exercise entirely, reinforcing a sedentary lifestyle that deepens the cycle of obesity and arthritis. Over time, this reduced mobility leads to poor balance, greater risk of falls, and diminished capacity for self-care. Joint replacements, especially knee and hip replacements, are common surgical interventions in older obese individuals with severe osteoarthritis. However, obesity also increases surgical risks, including complications with anesthesia, infection, delayed wound healing, and lower success rates in long-term outcomes. Some orthopedic surgeons are reluctant to perform joint replacement on patients above a certain BMI due to these elevated risks. This can leave older adults in a painful limbo where surgery is either delayed or discouraged, forcing them to rely on pain medications, assistive devices, and lifestyle changes to manage their condition. Despite the challenges, meaningful relief and prevention are still possible. Weight loss, even in modest amounts, has been shown to significantly reduce joint pain and slow the progression of osteoarthritis. A loss of just 10% of body weight can lead to a 50% improvement in knee function and pain scores, particularly when combined with physical therapy and strength training. Exercise, though often feared in those with joint pain, is one of the most effective ways to protect joints. Low-impact activities such as swimming, cycling, water aerobics, and resistance training improve joint support by strengthening the surrounding muscles while also reducing stiffness and boosting circulation to the affected tissues. Diet also plays a powerful supportive role. Anti-inflammatory eating patterns such as the Mediterranean diet can help reduce systemic inflammation and may offer additional joint protection. Omega-3 fatty acids from fatty fish or flaxseed, antioxidants from colorful fruits and vegetables, and avoidance of highly processed foods can all support joint health indirectly through inflammation control. In some cases, targeted supplementation with vitamin D, calcium, or glucosamine chondroitin may be recommended, though results can vary and should be supervised by a healthcare provider. In the context of aging, the importance of maintaining joint health cannot be overstated. When joints become painful and dysfunctional, every aspect of life is affected: mobility, independence, social engagement, and emotional well-being. Obesity magnifies these risks, but also offers an actionable target for intervention. While reversing arthritis completely may not be possible, reducing excess weight, strengthening supporting muscles, and improving dietary quality can slow or even partially reverse functional decline. For older adults, these changes often translate into more than just reduced pain. They bring renewed confidence in movement, less reliance on medications or assistive devices, and the ability to stay active, involved, and autonomous well into later life.